So today we'll be talking all about 6 must-do tests for you and your partner before having kids or marriage. So the first thing we'd encourage is a general health checkup. You can check on your weight and nutrition, your exercise and lifestyle habits, current medications and supplements, medical history, including your menstruation history, previous pregnancies and outcomes, and chronic health condition management. It's important to know that some medication that you may be on may not be safe in pregnancy, so it's important to get those checked out. It's also important to know that some illnesses that you may have can worsen during pregnancy, so it's important to have them under control before getting pregnant. Another thing is your vaccination status checked. So CDC recommend that anyone planning to get pregnant update all their vaccinations as needed, especially the MMR, which is what we call the measles, mumps, and rubella vaccine. Rubella itself can be very harmful during pregnancy and can even cause miscarriages and death. Some other ones that you should be up to date for are your DPT, tetanus, diphtheria, pertussis, hepatitis B, chickenpox, influenza, and even COVID-19. It's important to know that if you or your partner get the disease in your 3rd trimester or when you're close to giving birth, you're bringing a newborn home to a sick partner and this baby doesn't have any immunity yet. So it's important to know that that can easily be passed to the baby. Another thing is a sexually transmitted infection screen. So these include chlamydia, which has been linked to preterm labor, low birth rate, eye and lung infection. Gonorrhea can lead to miscarriages, premature births, and low birth rate. Syphilis has also been linked to premature birth as well as stillbirth, in which the baby dies inside, and problems with multiple organs, including the baby's brain, the baby's heart, the baby's skin, the ears, the eyes, the teeth, and the bones. So it's standard of care for your doctor to check for chlamydia, gonorrhea, HIV, hepatitis, and syphilis during your first visit. Another one is genetic screening. So pre-pregnancy genetic screening is what we call carrier screening, and it's done using a blood sample or a tissue swab from your cheek, and it determines if you or your partner carry abnormal genes that is linked to certain diseases that might be passed to your baby. So these include cystic fibrosis, spinal muscular dystrophy, and even sickle cell that is very prevalent in the African American population. This screening before you get pregnant give you the option to do IVF or in vitro fertilization or even pre-implantation genetic testing. So what it does is that it identifies the genetic defects in the embryo before implantation. So some embryos will be affected and some may not be affected. So the doctor will transfer the embryos that are not affected into your womb for you to have that baby. Another test is a dental checkup. During your pregnancy, your body goes through hormonal changes that cause excessive gum inflammation, which we know as pregnancy gingivitis. And the bacteria can lead to negative outcome during your pregnancy and increase the risk of premature delivery. There's also small amount of radiation that is done to examine the teeth, and we'd recommend to do that before pregnancy to prevent X-ray radiation from affecting the baby. And lastly, it's important to do a mental health check for both you and your partner. Studies show that having depression before pregnancy is more likely to be associated with developing more depression during and after the pregnancy. A professional can help you and your partner with tools to cope with stress so that you are better equipped to handle emotional changes during and after your pregnancy. And if medications are required, there are many options that are safe for your pregnancy.